All right, so I'm going to talk a little bit about what has been going on in the media recently with a colleague of mine. I'm sad to say, you know, like nobody really wants any situation like this to happen to their relative or even to, a nurse, a colleague, a nursing colleague. I'm not going to talk much about what happened, what transpired at that time, but I'm just going to say when it comes on to nursing here in the US, that was something that was always concerning for me because in Jamaica, where I was trained, that's where my background is in emergency room nursing. Um, a lot of times we are always anticipating the worst. All right, we're always anticipating the worst. And a lot of times I feel as though it was because of the resources, whenever I had resources readily available. So the nurses are always being very proactive. And even without, the fact that it's a matter of short staff or lack of resources, we were always trained to be thinking ahead. Think about the possible effects or the worst possible outcomes that you can think of. So when you're in the hospital, in the emergency room, whether or not you are a certified emergency room nurse or you're a midwife working in the emergency room, everybody had to understand that when you have an emergency, when you have a patient in labor, it's everybody's business. And there is no sitting down about it because one thing you want is to get that patient to the floor. When I got here, it was the same. And it was just a little bit different because at that time it seemed as though nobody had much interest in taking care of the patient. Yeah. And that was it for me. Seeing the video and how some persons will go about with doing certain things. For me, when I'm in triage, I do things a little bit differently because I always have my clipboard. I always have paper that I'm writing on. And the most important thing is to make sure that the patients and the relatives see that me actively I do things to make them feel comfortable and make their wait time in the emergency room not being long. So when I have a patient that has been involved in any form of trauma, their chest pain or sickle cell, crisis, your mother who are in labor, your fall patient, elderly patient, you don't really see me sit down and do any form of triage because I'm up and getting things going for those patients because those patients are, they are emergency. So all the patients that come through the emergency room, yeah man, I emergency them. But those patients are my emergencies that need, attention. They need to go to the right place right now. So if it means that I need to stop what I'm doing and take the patients to CT scan, I'm going to do that. Activate the trauma and get them to wherever they need to, I'm going to do that. Transport the patient to labor and delivery, I will do that because it's going to be my problem in triage if I don't put some urgency to it. When I have patients like these, I will get information from the patient's relative that are present. I will go ahead and call my charge nurse, let them know that I need a tech. I demand a tech. I ask for a tech to come and take the patient to the floor while I am calling up by the labor and delivery floor to let them know the information about the patient. Yes, you have to get the patient to register, but I feel as though it's something that can be done on the way to the floor. And so I don't prolong having a patient in the department. I will get the simple things like their vital signs, their name and date of birth, because those are very important for registration. And then I will get them to the floor and I'll ask them, do you have any allergies? I'll send them to the floor. At that time, I will go ahead now and get them registered while they're out of my department or out of my little triage area. But I'm not sitting around, with any patient that is actively in labor or having significant amount of pain because I'm trying to get them into the system. Yes, we understand that the protocol at different facilities, it varies and you have to get certain things going, but I feel as though you need to know what you need to get at that time. You understand, to fast track the process so the patient problem don't become your problem later on. You understand? Because this patient in labor, active labor, is now the problem of the nurse. You understand? And her license is now in problem. So when it comes on to perspective, everybody have their own opinion as to what is going on. And we understand that, yes, she's in active labor. And at the same time, she might be thinking that she needed to do certain things. But for all new nurses that are going out there, one thing I can tell you is when you have your patients and they come in front of you, always think about a differential diagnosis. Always think about the worst possible thing that can be happening to the patient and make sure you're doing everything in your power to ensure that patient gets to the right department or to the right location. If it's a chest painer, you go ahead and get the EKG for yourself. If you don't have a tech, You can do EKG as well. So get the EKG, get the time stamp and everything, and get the patient to the right location, because that is very, very important. If you have a trauma patient, you don't need to sit down and wait for a tech to come and say, okay then, if you know where the CT scan room is, so go ahead and get the patient over there after you do your activation. It's the same thing for your labor and delivery patient. Go ahead and call and find out who can transport this patient. If nobody can transport this patient, you know that you don't know how to deliver any baby. So guess what? You're going to rush with that patient to wherever the patient needs to be at. And the most important thing is you always have your walkie-talkie, so you can always tell the charge nurse, say, find somebody to come and cover the triage area, or you come and cover the triage area in the meantime while you're transporting that patient to the floor. You understand? So there are so many things that he can be doing in the meantime, but the most important thing is the patient that is in front of you. You don't want that patient to start, having their baby in that wheelchair or on that floor, or the patient just decide to go and lie on your triage bed or whatever it is in that area and just start pushing. You don't want that to be happening. So the most important thing is think about what is happening, get all the information that you can. You can get the information while you're pushing the patient up to the floor. You can get all of those information. But 3 things that are very, very important for me, for every triage patient, is their name, their age. No, not their age, their name, their date of birth, and allergies. Once we get that information, we're good to go. Patient can go to the floor, you understand? Because we can go ahead and start treating safely, given the fact that we have allergies and the patient won't react to it. And then we can get all the other information afterwards, you understand? So go ahead and think about all of those things. And the other thing I would tell you is, when you have a patient that come in front of you and them a ball, when a patient come in front of you and a cry, whenever a patient that is like, very tearful, and the patient tell you that they're going dead, yeah, take it as it. They're dying. Yes, when a patient tells you that they're having a lot of pain, yes, take it as is. So when they say, oh, I'm having pain 100 out of 10, believe them, okay? Believe them and do whatever you can at that time to help the patient. For me, when those patients present, me stamp long time. I get them vital signs and I get them over to the EKG machine. And if it's a chest pain, I'm not getting any vital signs at that time. I get the EKG, and while they lie down on the bed, I get them their vital signs. So you have to think about what is happening and what is important. Prioritize what is important for the patient at that time and get it done and out of the way, because at the end of the day, it's your license that is on the line. At the end of the day, you are the nurse that is trained, that is in front of this patient while the patient is having your medical emergency or surgical emergency. So you have to think about what is important and how you go about with making sure that this patient is safe and this patient don't die on you. The last thing anybody want is a dead patient in front of them. Me don't want it, I'm sure you don't want it. So go ahead and protect your license by making sure that you're thinking straight, you're critically thinking and analyzing, and just making sure that you're crossing your T's and dotting your I's on every patient that is stepping in front of you. Because you don't know which one of the patient can kick the bucket. You don't know what patient that comes in front of you with what condition can just decide, say, okay, then today's the last day I'm going to be breathing, and this is the place I decide to take my last breath. Know what you're doing. Think about all the possible outcomes for the patients that are coming in front of you, and make sure you have a plan in mind. But most importantly, put an urgency. Put an urgency in everything that you're doing. Make sure, say, your patient and them relative see that you care. Run around the place, run around looking like a gig. Make circles in the department, go above and beyond as you see it fitting for each of your patients, and try to give the best care. And if you're able to do that, you will protect your license at the end, all right? And make sure that the patient is still safe. As I said, this is just my little addition to everything that is going on in the news right now. But in the meantime, go ahead and share your thoughts down below, and we'll see you in the next video. All right, bye.